Hello, my name is Stacy Williams, and today I'm going to be doing an assessment of the abdomen. But what you will need a stethoscope, a measuring device, you're going to need a marker, and you're going to need a pen light or a flashlight. So let's get started. Hello, Eliana. My name is Stacy Williams, RN, and I'm going to be doing an assessment of your abdomen today. And Eliana, is that the name that you wish to be called?
Yes.
Okay. All right. Well, I'm going to ask you a few questions, which is subjective data, which is subjective information. That's information that comes from you. And then after I'm done with that, then I'll come back and do a hands-on assessment of you. Okay?
Okay.
All right. First, let's ask about your appetite. How's your appetite?
It's normal.
Okay. Do you have problems with difficulty swallowing?
No.
Okay. Food intolerance. Are there certain foods that that you can't eat that make you sick or anything like that?
Not that I know of.
Okay. Have you been experiencing abdominal pain?
Yes, I have.
Okay. Can you point to that area?
Right here.
Okay. All right. Is it occasionally? Is it all the time?
It's now and then.
Okay. What makes the pain worse?
Usually it's after I eat.
After you eat? Okay. What makes it better?
Eating.
Okay. So the pain comes after you eat, and then you eat again, and you feel better?
Yes.
Okay. Any problems with nausea, vomiting?
No.
Okay. What about your bowel habits? How many times do your bowels move a week?
It's hard to estimate that.
Okay. All right. Tell me about the consistency. Is it firm? Is it loose? Is it diarrhea?
It's soft.
Soft? What about the color?
It's brown.
Brown. Okay. All right. Now, let's talk about your past history. Do you have a history of appendicitis or acid reflux or colitis or anything like that?
Not that I know of.
Polyps? Okay. All right. Now, as far as medications, do you take any medications to help you when you have stomach problems, like an antacid or Pepcid or anything like that?
Maybe.
Any stomach medication?
Not that I know of.
Okay. Okay. And as far as your nutrition, how many meals do you eat a day?
3.
Okay. 24 hours. Can you give me the menu of what you had 24 hours ago?
For breakfast I had eggs, bacon, grits, and for lunch I had
Okay.
a sandwich, and then for dinner I had a hamburger and fries.
Okay. All right. Okay. All right. Well, I'm going to put this information in, and I'll be right back, and we'll be doing your assessment. Okay.
Go.
Okay, Eliana. What I'm going to need for you to do, you're going to lay back here on the examining table, and I'm here to help you lay down. Okay. Okay, you lay back. Okay, your hands to your side, please. Okay. And before we begin, let's get a little sanitizer here. Good. The first thing that we're going to do an inspection of the abdomen. And what you will see, I'm looking for the contour of the abdomen. And looking at the contour, I'm looking to make sure, or basically to see if the abdomen is round or if it's flat or sunken. So she has a normal abdomen. I'm also looking for symmetry. And by looking for symmetry, I would take a flashlight and look over her abdomen. And I'm looking for masses or unevenness. You will see a shadow. So there are no masses over her abdomen, and the symmetry is good. And I'm also looking at her umbilicus. Okay, with the inspection of the abdomen, also you're going to look at the umbilicus area. And here we're looking for hernias or discoloration, drainage, and she does not have any of that. You're also looking at the skin's pigment change for pigment changes, such as a discoloration, such as yellowing of the skin, which is a sign of jaundice, or striae, which are stretch marks. And you go into other medical issues whenever the striae or stretch marks have turned to a bluish shade. You're also looking for abdominal lesions or scarring or moles that should not be there. And also you're looking for pulsations of the abdomen. You're looking for movements that should not be there, because you should not see any pulsations of the abdomen. You're also looking at the hair distribution, because that's also a condition. In women with the pubic hair, it should look like an inverted triangle. In men, they have a diamond-shaped hair distribution. Now what we're going to do, we're going to auscultate. And that means that we're going to listen with the stethoscope for bowel sounds, which is basically just the transferring of gases through the intestines and food. So we're listening for bowel sounds. Okay, let's get started with that. Okay, first we're going to listen here in the right lower quadrant. The abdomen is divided up into 4 quadrants. You have your right upper quadrant here. You have your left upper quadrant. You have your right lower quadrant and your left lower quadrant. And we're going to start listening here at the ileocecal valve area, because vowel sounds are normally always present there. And in each section or each quadrant, you listen at least 5 minutes before you declare that there are no vowel sounds. But because the vowel sounds are so active, you have between 5 and 30 within a minute's time. You can just listen here and make sure that the vowel sounds are either hyperactive or hypoactive. So I'm going to listen here to the right lower quadrant. And I do hear vowel sounds. It can be high pitched, it could be gurgling, it could be cascading sounds, and like I said, it can occur irregularly, anywhere from 5 to 30 times per minute. Okay. You also have to auscultate vascular sounds, and vascular sounds are basically the bruits. And you shouldn't hear anything, but here we're going to listen for the aorta artery. Then you have the left renal artery, right renal artery. Then you have the left iliac artery, right iliac artery. And then you have the femoral artery here. Usually no such sounds are present. Now the next assessment we're going to do percussions, and that's relative density of the abdominal content, and to locate organs, and to screen for abdominal fluids or masses. So we're just going to do, in a circular motion, just a percussion of the whole entire abdomen. And we're going to start here, and it should be just timpani. And if you hear dullness, it will occur over a distended bladder. And hyperresonance is present with gas distension. Okay. All right. Now to assess the kidney, we're going to be placing our hands here at the 12th rib at the intervertebral angle in the back. And I'm going to place one hand here, and I'm just going to give a thump on the back of my hand. And the patient should not feel any pain. Eliana, did you feel any pain?
No.
Just a thud. Okay, and that's just percussing the liver. Percussing the kidney. Our next step we're going to palpate, and we're going to start off with a light palpate, then we're going to go to a deep palpate. And we're going to go in a circular motion around the abdomen, and that's just basically to check on size of and size and location of certain organs. Okay, we're going to start here. And that's just only a 1 centimeter press. Now for deep palpation, we're going to go at least 2 to 3 inches, and we're going to also go in a clockwise motion. And it's just a little deeper. And you may wonder why my hand is on top of my patient's hand, and that's because she's ticklish, and that will keep her from feeling like she's tickling herself. So a person is not ticklish when they're thinking that they're not that they're using their own hand. So that's why I did it that way. And that's a deep percussion. No hardening or enlarged organs found at this time. Now I'm going to palpate a certain organ, and I'm going to palpate the liver. And what I'm going to do, I'm going to be using my right hand, and I'm going to press at least 1 to 2 centimeters. And you shouldn't feel, some people you can feel the edge, some people you cannot, but it's right here up under the ribs. So I'm going to ask Eliana to take a deep breath. Take a deep breath. Okay. Take a deep breath. Okay. And let me correct that. It is normal to feel the edges of the liver. Bump your fingers as the diaphragm pushes it down during inhalation. It feels like a firm, regular ridge. Let me go back and say that. This is also another way to palpate the liver. It's called the hooking technique. And you basically take your hands and you go up under the costal space. Take a deep breath. There it is. You can feel the edge of the liver. And I do feel her liver bumping my fingers. That's called the hooking technique. And now what we're doing, we are basically checking the aorta's pulsations. And it's located in the upper abdomen slightly to the left of the midline. And it's normally 2.5 to 4 centimeters wider than an adult. So, yeah, we're here. Okay. And I do feel the pulsate. Okay. And that's just checking the artery. If it is larger than that, if it's larger than 4 centimeters, you're looking at an aorta aneurysm. And that's checking the aorta. Test. Okay, Eliana, what I'm going to do, I'm going to press deeply into your abdomen, and you let me know if you have any pain when I release, okay? Any pain there?
Mm-hmm.
Okay. And my hands are going in at a 90-degree angle, students. Any pain, Eliana?
No.
Okay, if Eliana would have complained of pain, we would have maybe thought of some peritoneal inflammation, and we would have let the doctor know to do further studies like a CT scan. The next test we're going to do is called, and that was what I just performed was the Blumberg test. I'm sorry. And the next one is the Murphy sign test. And it basically checks for gallbladder problems or gallbladder problems um, or inflammation. And what you would do, you would press firmly here at the liver's edge and tell the patient to take a deep breath. Take a deep breath, Eliana. And there should be no pain during that inhalation. Did you feel any pain there?
No.
Okay, very good. If she would have complained of pain, we would have thought of maybe gallbladder inflammation and had further testing ran on her. The next test we would do is the iliopsoas muscle test. And with this test, it's basically due to appendicitis. You will have pain. Okay, Eliana, what I need for you to do, I need for you to raise your leg. And when the client raises their leg, you press on the leg. But what I want you to do is I want you to resist. And you will push on the thigh. Okay, are you having any pain with that?
Not much.
Okay. If the patient complains of pain, then you're looking at a potential appendicitis. You can do another test by taking the ankle, flexing the knee, and we're going to rotate in and outward. Any pain?
No.
With that test, it aggravates that particular muscle, and that's when you would consider appendicitis. And I believe that's all of my assessment.